Effer-K is a mineral supplement used to treat or prevent low levels of potassium in the blood. Potassium is essential for the proper functioning of your cells, kidneys, heart, muscles, and nerves. Most people get enough potassium from their diet, but certain conditions like prolonged diarrhea, vomiting, hormone problems, or treatment with diuretics can lower your potassium levels. It is important to take Effer-K as directed by your doctor to maintain a healthy potassium level in your body. The typical dosage is usually once or twice daily, and it is best to take it with food to avoid stomach upset. Be sure to follow your doctor's instructions on the timing and dosage of Effer-K to get the maximum benefits from the medication. When taking Effer-K, it's important to follow your doctor's instructions. Typically, you'll take it 1 to 4 times a day with a meal to prevent stomach upset. Dissolve the prescribed number of tablets in at least 4 ounces of cold water or juice per tablet, then sip the liquid slowly over 5 to 10 minutes. If you experience stomach upset, mixing your dose in a larger amount of liquid may help. Remember to take Effer-K regularly at the same times each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so don't increase your dose or take it more often than prescribed. If your condition doesn't improve or you experience symptoms of low potassium in the blood, such as irregular heartbeat or muscle weakness/cramps, be sure to consult your doctor. If you experience upset stomach, nausea, vomiting, gas, or diarrhea while taking Effer-K, it's important to let your doctor or pharmacist know. However, many people using this medication do not experience serious side effects. In rare cases, a very serious allergic reaction to Effer-K may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. Additionally, if you experience vomit that looks like coffee grounds, stomach/abdominal pain, or black/tarry stools, it's important to get medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed above, be sure to contact your doctor or pharmacist. As for the best time to take Effer-K, it's important to follow your doctor's instructions for the correct daily dosage and timing. Be sure to consult with your healthcare provider for personalized advice on how to take this medication. Before taking Effer-K, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have heart or kidney problems, high potassium levels in the blood, or throat/stomach/intestinal issues. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and supplements you are taking. It's also crucial to consult your doctor before using other potassium supplements or salt substitutes, as too much potassium can lead to serious side effects. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of taking Effer-K with your doctor. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you are regularly taking other medications that can also raise your potassium level, such as drospirenone, eplerenone, ACE inhibitors, angiotensin receptor blockers, or potassium-sparing water pills/diuretics, be sure to inform your doctor or pharmacist. This is to ensure the safe and effective use of Effer-K. Always follow your healthcare professional's instructions. If someone takes too much Effer-K and experiences severe symptoms like passing out or difficulty breathing, it's important to call for medical help immediately. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, muscle weakness, and confusion. Make sure to seek help right away if someone experiences these symptoms after taking Effer-K. It's important not to share Effer-K with others. While taking this medication, you may need to have lab and/or medical tests to monitor your potassium blood level and kidney function. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking Effer-K, it's important to maintain a well-balanced diet. Foods that are high in potassium include bananas, oranges, cantaloupe, raisins, dates, prunes, avocados, apricots, beans, broccoli, spinach, potatoes, lentils, chicken, turkey, beef, and yogurt. If you need help figuring out which foods to include in your diet, consult your doctor or a dietitian for recommended options. If you happen to forget a dose of Effer-K, take it as soon as you remember. However, if it's close to the time for your next dose, it's better to just skip the missed one. Don't take double doses to make up for the missed one. Stick to your regular dosing schedule. Keep Effer-K at room temperature, away from light and moisture. It's important to store this medication in a safe place, out of reach of children and pets. When it's expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush Effer-K down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.